Hi, Stuart Roseler here again from the LBG Medical Customised Lab. Today we're going to talk about medial flanges. Well, medial and lateral, because essentially it applies the same. So a medial flange, what is it? Essentially it's an expansion on the inside part of the orthotic that allows the contact surface area of the device to be increased. Okay? And if we increase the surface area that we contact our patients, we can then influence pressure and load, which also can then spread the load and make, theoretically, the devices a little bit more comfortable for our patients, which is always good for the engagement side of things. Okay, so when we expand the medial side and you ask for a medial expansion, it's actually the dimensions and the characteristics of the foot that will determine how wide or high it is. Okay, but you can tell us how high you would like it to go, and then we'll apply that material, but that'll obviously influence the width. You can see the evolution that we've had from our devices over time. This is what we were doing 12 months ago, okay? And then we've been able to manufacture them so they're expanding up in the internal part of the device there. So, older device, okay, quite firm and rigid, whereas a newer device, a lot more slim and slender. And of course that'll then be more determined on the thickness that you ask for this direct milled device in a flange. If we look at the direct pressed or vacuum formed device, in the same thing, we've added material to the foot, okay, so we've added plaster, which has then increased the width and the size of the medial device there. Okay, so that's a medial flange on a direct pressed device. What's the purpose of them? Essentially what I said before. So we're trying to expand and capture that foot with a surface area. So anytime that we start to talk about area, we start to talk about pressure and the forces related to that in the foot. So you can have them on the medial side. You can also have them on the lateral side, which we have a slight example over here. Okay, there's a lateral expansion, and then you can also have a lateral heel expansion, okay, which is where you'll see on this one here. It's related around the heel. So if you go a lateral heel flange, that's this one. You can see it through that area there. Medial flange, lateral flange. Okay, and they're all determinable by direct milled and or direct pressed. That's about it on a flange. As I said, medial or lateral. Think about your patient. Think about the surface area that you're trying to contain. And also, quite importantly, think about the tissue expansion that you get in and around those areas. What you're trying to contain versus the forces that you need to deal with. Thank you. See you again soon.